Okay, welcome back. This is part 2 of the homework assignment 4 that was conducted, or for lecture 4 that was conducted. So this is part 2 of homework assignment lecture 4, which is assignment 2. So just to start off, again, we have discovered or discussed the functional movement screen. So now we're going to move on to point 4 and 5 I've added. Discuss and apply knowledge on the monitoring tools available for youth to prevent burnout, but also discuss the assessment protocol for youth athletes. The objectives that were here didn't quite discuss the assessment protocol. Indirectly, yes, but not directly. So again, make sure that you know the assessment protocol. So our next question, next week a team of youth athletes are coming to the biocenter, discuss the pre-participation athletic screening you can put in place to determine their need for corrective training. Okay, so if you were to work with children or athletes, the following should be completed in your pre-screening. Some of this is covered in Abraham's, but for those of you, because you have done an undergraduate course, you should have understood, or you should have been aware of the fact that that assessment was not holistic enough. Okay, so the first thing you want to do is obviously do a risk stratification with your child or youth athlete. You also want to conduct a PAR-Q plus analysis, and I will show you this now online. And then you want to check what is their history, their history of injury. And these will do in your pre-participation screening to make sure that the person is actually cleared for participating in physical activity, and whether they need rehabilitation or not. Okay, so this is just an example, teaching exercise to children, a complete guide to theory and practice. Not one of the books that we have specifically referred to, but I wanted to show you here that what I'm talking about in terms of children is also related or identified in books by authors like Mark Colson. So the screening, there's the example of your PAR-Q, and the PAR-Q is your physical activity readiness questionnaire, where there are specific questions asked about, for example, do you have any chest pain when not exercising? Do you frequently feel dizzy just for no reason? Do you fall? Do you pass out for no reason? Do you have any orthopedic problems that we need to know about? Do you have any cardiovascular metabolic conditions that we need to know about? And all of these, if you answer yes to any one of those, then you need to send this individual for a clearance by their doctor. Unfortunately, the actual questionnaire is not visible, but for those of you who want to see a PAR-Q in more depth, or if you are going to be doing a pre-screening, there is your example. Here is a book that you can go and look at. Okay, so for children as well, as we would do for adults, we do a risk stratification, and here you will see child 1, intensive lifestyle management, and so forth. So similarly to adults, you'll go through a similar risk stratification, asking them about family history, their cholesterol profile, obviously kids smoking, but smoking more indirectly with parents who are smoking. What is their blood pressure, heart weight, their BMI? We've already done BMI together. What is their sugar level, and what is their current physical activity, eating, and exercise history. So again, briefly, same for children, where you would identify their risk. Just so you know, for myself personally, when I was 8 years old, I had high cholesterol. My cholesterol was I had a score of 8, which is quite high, and that can lead to problems later down the road. So again, you're doing that as an early warning system. You might be getting an athlete in, but that athlete could have comorbidities that you do not yet know of. Okay, so you continue with that. Then we go to postural analysis. Again, you guys should have done a postural analysis by now. If not, let me quickly take you through the postural analysis. So for postural analysis, going through the plumb line, this picture is now not downloaded properly. Let's just check. But whilst we wait for that, let me show you some of the postural deviations. View image. So some of us in the class might have a sway back posture, lumbar lordosis. We might have kyphosis, forward head posture, or good posture. Good posture is where the plumb line runs through the midpoint of the ear, the shoulder, the trochanter, and then through the knee, midway through the knee, and slightly anterior to the malleolus. So those of you who have been paying attention in anatomy class, you would have identified that. It looks like that picture is not going to download, so not to worry. Have a look through these documents. I would again, if I'm going to look at specifically whether something is correct or not, I would go and look at a book instead. Fundamentals of Musculoskeletal Assessment, and yeah, they talk about the plumb line and actual giving corrective training exercises for your musculoskeletal disorders. So again, make sure that you have a look at that. For the purpose of this module, just knowing the basics, but for those of you working with this specific population group in the future, it's important that you know how to conduct a postural analysis. Okay, current physical activity levels, important to know. So again, all of this being done before you actually even get into doing any assessments. And the physical activity levels comes in with some children training sometimes 5 to 6 hours a day, and the training not being done correctly, or going between rugby and cricket and soccer and netball and dancing and other types of activities with excessive amounts of loads placed on the body. Okay. Your next assessment will also be current monitoring tools in place to prevent burnout. So again, still sitting with the questionnaires. So before you've even left, we can maybe actually take that one out. And then these are all your assessments that you do before you even leave the chair that you're sitting on. And then how the athlete feels about participating in sport. A lot of us, we forget to actually ask the youth athlete themselves, how do they feel? And sometimes the parent is more in charge. So then it's important, once you know all of these factors, to work with a psychologist if need be. Sports psychologist, of course. Okay, so once your adolescent or child is cleared for exercise, you can continue to the next set of assessments. Even though they may not have been maybe exercising, you are there to be an early warning system, as I identified earlier. So you might find these assessments to be unnecessary, but they are necessary. You are going to find whether or not the child has any problems or adolescent has any future problems of orthopedics, metabolic conditions, and so forth. Perhaps here an important one is in your pre-screening, you identify whether they have any asthma or need for further analysis in terms of their pulmonary system. Okay, now that you've completed the assessment with your youth athlete, you can decide on the next set of tests that you want to conduct. And let's say for the purpose of today, you move on to your functional movement screen. So I am not going to go through the functional movement screen again. I've gone through that in the previous YouTube clip, so refer to that YouTube clip to get more information. Once you have completed that, you can go on to your health-related components of fitness assessment. Make sure you know what your health-related components of fitness assessments are. We have done body composition together, BMI, using the CDC growth charts. And we have done a basic assessment of push-ups, push-up for muscular endurance, sit-ups for muscular endurance. Although we have not done this specifically in class together, I know that with Dr. Bart, you have completed these analyses. So health-related components of fitness, make sure you know what they are and the basics of the assessments. Just quickly for flexibility in youth, you guys have looked a lot at sit and reach. Remember, sit and reach, or any assessment that you're doing, you want to look at the validity and reliability of the assessment and whether it actually assesses what it says it assesses. So if you look at, for example, the sit and reach, and growth-related changes in the individual. If their legs are lengthening excessively during the growth spurt, you can imagine the test scores will come back poorer due to changes in body dimensions. But additional tests to do with that would be a straight leg raise, and that's part of your functional movement screen. Okay, then once all of that is assessed, then you go to your skill related components of fitness, and then it becomes more sport specific. So now you're going to identify whether you're going to assess vertical jump mechanics, whether you're going to do a Bosco jump assessment, whether you're going to do a pool based assessment, whether you're going to do a sprint based assessment, whether you're going to do a multi-directional change based assessment. There are many types of skill based assessment based on the sports that you would do to analyze your youth athlete. For those of you who want access to a book on the different types of assessments, go to the library and look through the sports section, assessments for young athletes, and you will get access to the types of assessments that can be done. Okay, perhaps we can actually take this one further up. So if we take that away, periodization, programming, what is this athlete doing at the moment, when is their training happening? Again, your youth athlete, quite a lot more assessments being done and quite a lot more monitoring required. So we had a question in class where the question was, would we do all these assessments with youth athletes? And the answer is yes, you would. This type of assessment can be broken up into different sections. You might have the athlete come in for a pre-screening, postural analysis, and strength application programming that they need to do twice a week in conjunction with their programming. And then you might get someone coming in saying they want more specific skill-based assessment, where they want the coach might want more information on the athlete's performance and how that can be improved. So you would scaffold your assessments to depending on what the needs are, and package your assessments appropriately. Again, if you're sitting in a position now where you're working with youth athletes, you must look at the literature, look at the evidence that is available, look at the injury risk profile of many youth and children and how to optimize their performance, and you will quickly see that all these assessments are necessary. However, the way in which you assess and implement these assessments will depend on your management structure within the club and the funding that is available and the collaborations that you have in place. Okay, it's normally a team-based approach. You can have dietitians on board, you can have physiotherapists on board, you can have biokineticists on board, you can have your coach on board who work collaboratively. Of course, this depends again on your funding available and how you manage your club. But a lot of these assessments you can do yourself if you put the right management structures in place. Okay, so just to repeat before we finish off this clip on the assessment protocol for young athletes: risk stratification, injury profile identification, and here's an article that you can go read, and those of you who have read it actually already, on what types of injuries adolescents can have and why, and how that relates to their musculoskeletal system. So some of them will have injuries, probably most of them will have injuries. Maturational age, not included in the previous documentation. I should probably add that now. But maturational age, important to consider, as this will tell you whether the person is an early, late maturer, and so forth. So maturational age, make sure you get the parent's height. Maturational age, make sure you get the parent's height, and you identify all of those. Arm span, seated height, and leg length and torso length, and you can see the dimension changes and how this affects changes in the individual's performance. Okay, I've already told you weight and height status for dietary guidelines. This is just basics. You have done this CDC chart, so you should know how to identify whether someone is underweight or overweight, and then I would add skin fold assessments with that. Okay, just an overview here for you so you know. 95th percentile and above, between the 85th and the 95th percentile, and then under the 5th percentile, each one having a specific link to being either obese, overweight, or underweight, respectively. Okay, decision 4, assessment and continuous assessment of burnout and fatigue. Okay, so a lot of us forget about this, and we aren't educated in this, and we don't know how to listen to our bodies, because in life you get these memes, or you get these coaches or parents telling you no pain, no gain, but at the end of the day, too much pain will equal no gain, and eventually you will burn out completely. So, symptoms of overtraining, have any of you ever suffered from these? And if you are, it'll be a good idea to start assessing your overall physical activity regime. What are you eating, and how much time you're spending sleeping, and so forth. There's quite a few assessments. We'll do this in the next document. Categorization of risk factors for overuse injury. Again, growth related factors, so you're busy growing, and you have all this added intense sport participation whilst your body is trying to grow, and of course that can add injuries. Why we do our risk stratification? Because previous injury can lead to burnout or overuse and so forth. Maturational dysfunctions, psychological factors, and training workload, training and competition schedules, equipment, footwear, environment, sports technique, and psychological factors. So you can see how all of these factors can lead to not only overuse injuries, as the top of the document states, but also can lead to eventual burnout. Okay, factors related to burnout in young. Again, environmental factors, looking at, and that's why you ask where they are in the periodization cycle, what is the intensity of their training, what is the frequency, what is all of that, who is the coach that they're working with, chat to the coach about it. Performance evaluations. Again, with all these assessments, try and when you give feedback to your youth athlete and parents, try and be as diplomatic as possible and positive as possible, and work towards improving that athlete and not breaking them down. And then personal characteristics. Some of us in class may even be like this, but you might find a youth athlete that is the same. Perfectionists, need to please others, non-assertive, and so forth. Low self-esteem, high perception of stress. So important to know these factors. Okay, daily assessment for burnout. I've already told you about the physical activity questionnaire. So you want to know, out of a day, what type of activities is this person doing? Monitor fatigue and recovery. That is your RPE scale, assessing weight and pre and post intense sessions, monitoring heart rate, monitoring dietary intake, monitoring RPE I've already mentioned, and menstrual cycle. Okay, there's a physical activity recall questionnaire example. There is your, what you guys have read, an assessment, training loads. There's your before and after session weight assessment. Again, some of you thinking there's no way I'm going to do all of this in my coaching sessions. Again, you must sit down and decide how you're going to manage your session and what you're going to do with that information. Okay, resting heart rate upon waking, daily food. Again, many of us don't look at this, but if you know about the effects of being dehydrated on the body, you would make sure you drink enough water every day. And if you want your youth athletes to maintain good performance levels in the gym or on the field and so forth, you would make sure you teach them in how to stay hydrated. Physical education basics. RPE scale, you can do that at the end of every session. And then remember, with children or youth, you give a little picture. Some pictures are more valid than others, so you find the best one. And then, as we discussed in class, the female triad, you've got to make sure with the parents' consent that you are double checking the females, your female athlete's reproductive function, as this relates to overtraining, relates to eating disorders, relates to bone density problems, and relates to in the future for those who want to have families, not being able to have a family. Just repeating the postural alignment deviations. Again, some of you might have gone through this already in class with Dr. Bart or Mark. But if you haven't, then here's your opportunity to learn a little bit more about it, but you definitely will next year in your biokinetics year. Functional movement screen, just a repeat, making sure that you've heard what was said earlier in the first YouTube clip, and then just showing you again the assessments of medial deviation, optimal body alignment, what makes a good lunge, how this relates to sport and what the person would look like either in the water or maintaining optimal alignment, types of activities that you would do. Every time you're watching someone, these are the alignment properties you should be looking for. Again, shoulder, trochanter, knee, ankle, perfect alignment. And yeah. So your health related assessment, just showing you some of the pictures. Again, take a light read through this, but you basically got the Eurofit, Fitnessgram and AlphaFit test. Those of you working with youth athletes and you want to know whether they're meeting the minimum standards, here is your assessment. Again, you can find the norms for this and you can link it to a different assessment structure and different charging rates. Alpha test, there's example. Fitnessgram, there's the example. President's Challenge, there's the example. Some of this free online for you to do, some of it not free. Again, just telling you to make sure you know what the health related assessments of fitness are: aerobic, body composition, strength and endurance, flexibility and motor fitness. Okay, sport specific skill assessment. Again, this you would have to read up extra on. Those of you specializing in a specific sport, you will know exactly what assessment is needed to optimize. However, go look at long-term athlete development models by Itzvan Bailey and colleagues, and then of course new models on motor development that you can look at as well. This is just an example of assessments you can do with water polo players and what is normally assessed. In this one, specific physical fitness tests comprise of swimming test, 25 meter, 100 meter, 400 meter, and 4 times 50 meter test. Vertical body jump or vertical squat jump, and then there were some other assessments down there as well. So again, specific to the sport. Here's just an example of a netball assessment that you would do to see where your athlete's at and how you would improve them. And then I've also added some Dartfish analysis. Again, going to those who are going into sports science, you can see the difference between how you would work collaboratively with your biokineticist, who would run a lot of your tests. You would then work collaborative with your coach, who would take that information for injury prevention and in gym-based training, and then you would work with your sports scientist, who would do the specific assessments of the body mechanics whilst participating in sports, the tactical and technical skills, the number of balls lost whilst playing, and so forth. Okay. Assessing performance, just some examples of activities you can do, and then in summary for your class assessment purposes, discuss the 7 decision-making processes in terms of how you will create your customized strength and conditioning program for feedback to your athlete, coach, and parents. And that could be your question that you get. Okay, well done with keeping up with this video. Probably a little bit over 15 minutes, but definitely a bit more in-depth assessment required for your youth athletes. Those of you working with youth athletes, remember you can package this in different ways, and you must sit down and think as a coach, how do I optimize on this new knowledge that I've been given? How can I possibly create a competitive advantage for myself as one of the better coaches in PE with correct assessments? And how can I create work or job opportunities for myself when I work with youth athletes? If you have any questions about the baseline assessment for future analysis of youth athletes, please do not hesitate to ask me, and you can contact me via email or you can contact me in my office. Thank you very much.